come over if they'd like to, but they don't like to be interrupted, which I could understand. So, oh, okay, yes, thank you for coming. My name is Deborah Bakelich, and I am here to help host Dr. David Ajabaji. We met a couple months ago when he was presenting at a network group I was at, and I just thought that the message he had to share was valuable, and that we really needed to get this out there to people. So we're going around to the various Brightview communities. We're partnering with Brightview, and we're bringing Dr. David's message to everybody who wants to listen and what he can do to help fight this battle that we're all fighting with dementia, which is a terminal disease. So I'm going to turn over to Stacy, who's going to talk to you about the Brightview community, that you're all here.
Hi everybody, welcome. So yes, this is Brightview Hunt Valley. We are the newest Brightview here in the state of Maryland. We're number 47. We're going to turn 1 year old next month, but we do still have space available, but not a whole lot. Come on in, Norman, Carol. So just a couple of housekeeping tips. There are restrooms right out here to your left. Help yourself to any beverages. If you'd like to stay after and take a short tour of the community, we're happy to do that. But I think the most important thing here today is Dr. David and the topic that he's going to discuss with all of you. So thank you for being here. And let's welcome Dr. Ajabaji. Did I say it?
You did. Good job.
I've been practicing.
Good job. All right. Good afternoon, everyone. Is it coming across okay? Can you hear me all right? All right. A big thank you to Brightview Senior Living and for everyone, all the wonderful work you're doing. By the way, does everybody know?
Talk louder.
Talk louder. Okay. That's all I needed.
I don't know if you turn the volume up.
Talk louder. Is that louder?
Maybe
A little louder. Okay. Yeah, this, if you can.
new
That would be
technology
good.
being rebuilt.
I know. All right, so everybody knows that Brightview is the top 100 place to work in the U.S., right? Woo! Impressive. Super impressive. I'm really honored. I hope the risk you're taking on me to speak will be rewarded. So yes, we're talking about brain health, dementia, and let me see, I'm gonna get this started. Technology is a wonderful thing if it works right. Okay, so I always like to start with this quote because it seems like the whole idea of dementia casts a really, what do you call it now? A dark shadow almost over almost everybody who hears it. Most of you here, I'm going to assume, know someone living with dementia, maybe even a loved one. And some of you may have questions, some of you may have fears or frustrations. Some of you may even be concerned that because it's happened to someone, a grandmother, a grandfather, someone close to you, it's in the genes, it's probably going to happen to you eventually, and the clock is just ticking. And you're just waiting for your own diagnosis to show up. And I'm hoping that with what we're going to do in the next 45 minutes, do I have up to 45 minutes?
Yes.
About 45 minutes. Okay. Let me see what's, okay, so 5. Hoping that with our discussion today, that there'll be some clarity and hopefully some hope as well. So, anybody here who just wants to say a few things, your frustration, your experience with the whole topic of dementia, loved one, anyone? Anyone, any volunteer? Anyone want to say something? Hey, Brett.
Want us to label ourselves?
No! No labeling, please. But yeah, I mean, maybe someone wished they had known something about dementia before and they're just beginning to find out.
I know plenty about it.
How do you what?
I've learned plenty about it before. I don't think I want to know anymore.
It's a bad thing, right? That's all we need to know. It's a bad thing. All right, well, let's see if we can help to clarify some of the things. I'm going to say a few things about myself. I will not spend time on it, I promise. But you can tell that I'm not from this place, right? I'm from Nigeria. I'm born and raised. I even trained in Nigeria. But I came over to the US. I've come to the US several times for trainings, for certifications, for my master's degree and all that. And the goal, I have an ironic clinic till this day in Nigeria, and we decided to devote one day of the week exclusively to the very poor families of children who had brain disorders. And so that's what we would do for years, almost decades. We would just, that one Friday every week, we would attend to these kids. And they obviously, it's a big problem. We didn't have medications, we didn't have studies, we couldn't do blood tests. All they could afford was just the transportation to come. And I'm talking about really, really bad conditions. And so we knew we had three principles. It had to work fast, it had to be simple. I don't want to use the word idiot-proof because I'm not referring to idiots, but that was the idea. It had to be difficult for them to get wrong. And number three, and probably most importantly, it had to be safe. So whatever our intervention would be, had to fulfill all three, not just one, not just two, but all three. And again, because we're dealing with the brain, it was very important. And that's just pictures of me, giving the patients and the parents the same amount of time I would give to paying clients. All right, now, after looking back now, I feel I should have been the one paying them because I learned so much. I mean, in the process, we attended to hundreds of, maybe thousands of people like that, and the experience from that was absolutely critical to what we're doing today with dementia, believe it or not. And I just want to give a quick story of this child because we call her patient Zero. She came in because she was about 2 years old, insulin-dependent diabetic, so she needed insulin. The nurse made a mistake, gave her 100 times what the dose was supposed to be. Fried her brain, destroyed her brain completely. And when she came in, she was like rigid as a board. In fact, the term was hyperextension. She was like almost, the neck was almost touching the heel of her heels. And they had tried everything. They had some help. Someone took them abroad to try and fix it. Nothing worked. So, cut a long story short, we decided to give them I just thought about, well, omega-3s can't hurt, right? Everybody knows omega-3s are good for the brain. So we give them omega-3s, and at that time I told her just take 1 teaspoonful 3 times a day. She thought I said 1 tablespoonful 3 times a day. So you see the same mistake repeating itself, right? Well, this time it worked out. She came back, and 2 weeks later, she said it was magic. The child loosened up, began to have facial expressions, began to get better, and that was only on omega-3s. So that kind of like opened our eyes to the power of using specific nutrients at the right time and the right doses to help the brain. At that time, we weren't thinking about dementia. I just wanted to stay in my lane and just to work with kids, and we did that for a long time. But in the process, I would travel back and forth from Nigeria to the US to get, anytime I heard about a new intervention, anything I thought would help out, I would fly over, do the courses, look out for, if there was a researcher who had come up with a new intervention, I would, all over the country, I would go and sit at their feet and learn from them and say, teach me, what do I need to do to treat kids in Nigeria? And graciously they would. I think it also helped that I wasn't as big as I am now. As long as I looked like the kids I was treating, it's funny that I did have some sympathy. So yeah, I got a lot of help. And again, just to say this, I love this country. This country has given me so much. Everything that I know and I've been able to do has been because of the access and the people in this country. So whoever is in the White House, to me, this is the best country in the world. And it's done a lot for me. And I'll always be grateful. All right. So that's, in the long run, eventually we started really dealing with all kinds of brain disorders, and eventually we had volunteers and different people come and help us out. And because of our work, we received several awards, the last being, just last month, I received the Outstanding Private Healthcare Provider in Nigeria, even though I haven't been there in 5 years, so I don't know how that works, but for some reason, I guess my staff are doing a really good job, so really appreciate it. In Baltimore too, I've received some awards. Well, not awards, Baltimore Magazine's Game Changers edition, 2024, they included me because of the work that I'm doing in the Black community, especially in the Black community, because I feel that Blacks are most, if you're Black and you're a woman, you are the worst level, highest risk of dementia. And I felt nobody was really talking about that much. How are we doing so far? Is my voice, it has to be louder?
Yes.
Okay, all right, louder. Am I still in the frame?
Yes.
Okay. Okay, so I'll try louder. So, long story short, my mission today is to give you clarity. There's a lot about dementia that from what I'm seeing, simply isn't being talked about. Even in the ivory towers, the best of the best specialists, I don't think, even if they know it, I don't think they're properly, and it's not an indictment, I don't think it's properly being conveyed to the layperson and to the patients. And so I'm going to kind of like help you zero in. Say it with me. Zero in. Come on, guys, we can do better than that. Zero in. Thank you. I'm going to really focus on what really matters when it comes to brain health and dementia. All right, and then of course, hope, because I tell you, you're going to need a lot of hope for what's going when it comes to dementia. By the time a person has full-blown dementia, he or she has lost about 30% of their brain mass. That's a lot of brain tissue, I promise you. If you think about how much just a square inch or square millimeter can do, it's a lot. So that's one of the reasons why it's such a difficult thing to treat. You lose brain tissue for the most part, unless you have someone like, well, me, talking about, addressing and working with you, you've pretty much lost that brain tissue. And medical science at this point, well, I wouldn't say medical science, but conventional medicine, there is no treatment now for memory loss. If you're beginning to lose your memory, let's not talk about dementia or anything. If you're just concerned that you're forgetting words, forgetting people, there is no medication right now that can be prescribed. Now, there are medications for attention deficit, but when it comes to the loss of memory, there is none. Okay? Now, there's a lot I can do, a lot we have been doing where that's concerned, but when it comes to standard medication, there is none. The doctor is just going to tell you to keep coming back until you get dementia, and they'll be like, yeah, there's nothing we can do about it. So there's a lot of hopelessness, unfortunately. So, just in case you have to leave the presentation for any reason, I like to start with the end in mind. So let's start, let's see, we're going to give you the summary of really what's happening when we're talking about keeping your marbles. And really, it's not all that difficult. Bottom line, your brain, as you sit here, you are being assailed by, so on the red, on this side, the red, on the right side, the red relates to the things that are harming your brain. Just breathing air, you're getting toxins, no matter how pristine it seems. You're getting toxins in your brain, the food you've eaten, emotional stress, environmental stress, and so on, are affecting your brain for the worse. On the left side are the things, healthy things, whether it's exercise, whether it's good relationships, whether it's having a raise, good emotion. So those are things that are helping. So our principle is this: before someone comes down with dementia, there are three things. It's usually two or three things, two out of the two or three things that must happen, and that's what caused the dementia. It doesn't matter what kind of dementia you have. There are two or three things that must be in place. One, you've experienced, or your brain has been exposed to greater attacks, greater damage over the years, and obviously, if you're 80, you probably had more damage than someone who's 20. Make sense? Mm-hmm. All right, same thing. Fewer defenses or weaker protections. That happens over time, and I'll explain that later. And then number three, and this is again what I saw in the Black community, there was lack of that prompt. When things went wrong, they did not receive the treatment, and a lot of it is because they didn't even go for treatment, in the first place. I mean, we can blame racial inequities for part of it, but it's not all. That's not all that there is to it. There's a lot of personal responsibility involved as well. Okay, so this is what happens: the greater attacks, fewer defenses, and you can see the brain shrinking. So the idea is to keeping your marbles is to increase or reduce the attacks, increase the defenses, and then become more intelligent about your interaction with the establishments. Know what tests to run, what tests to ask for. And then if things are beginning to go wrong and you begin to see things go wrong with your body, be prompt to get that treatment. That's really what it comes down to. So in order to accomplish our task today, which is to give you clarity and hope, here are a couple of things, about 10 things, not a couple. About 10 things we're going to look at, and hopefully we'll get through it. Obviously the first thing is, what is Alzheimer's disease? And here's the definition right here. It's a progressive neurodegenerative disorder and the most common cause of dementia. It is characterized by the accumulation of two abnormal protein structures in the brain, and amyloid. Everybody heard about amyloid. Okay, everybody heard about tangles. So these are the proteins. These are the culprits that cause dementia. Now that is standard medical advice. I may challenge that, and so let's move on. This is the umbrella for dementia. Invariably I get this question. Well, what's the difference between Alzheimer's disease and dementia? It's like saying, what's the difference between a person and a man? Or what's the difference between a person and a woman? The umbrella, dementia is the umbrella term. Alzheimer's disease is a subset. Okay, and it's a major subset, it's about 75%. But there are about 100 different kinds of dementia. Alzheimer's disease is simply the most prominent kind. And there are some kinds of dementia that are easily reversible, and there are others that are not so reversible, like Alzheimer's dementia. From where I stand, I don't even understand the word. The truth is, there's almost, if you know what to do, there's almost no such thing as irreversible. Almost. I said almost. Most dementias are reversible if you know what to do, especially if you know what caused it. Because you can see, and for most of my patients, you can see the progression, how they eventually came down with dementia. All you need to do is just talk to them and listen to them, and you'll see what went wrong in their lives as things happened. All right, did you see something here that was interesting? That caught your fancy? Go back.
I did. It said on the last column, other dementias, and it said related to HIV.
Yeah. It probably should be related to COVID-19 there too as well. Yes, infections can cause dementia, for sure. Yeah. Yes, ma'am.
Do strokes cause dementia?
Yes, ma'am. So yeah, anything that can restrict your oxygen supply and nutrient supply can cause dementia. Okay. Here are the stats. I'm not going to spend time on it. We all know that Baltimore and Maryland are number one when it comes to dementia. Yes? You guys didn't know that?
No.
We're the kings and the queens.
In all 50 states?
All 50 states. Yes, ma'am. And,
Yeah,
yeah.
And women.
Yeah.
Is that per capita or total or?
No, per capita. So rates, the rate of dementia is. So there'll probably be other states with more actual numbers, but in terms of the rate per capita, yeah, it's a lot worse. Okay, anything else here? It's a bigger problem than breast cancer, and women are two-thirds, so twice as likely to have dementia as men. And when you consider the fact that women are majority of the caregivers, you know that there's a huge burden on women, and it's a big concern for me especially. Here's something else. Alzheimer's disease is the only one of the top 10 causes of death that cannot be prevented, slowed, treated, or cured. Is that true? Well, the truth is, we now know, and this is established research that shows, everybody knows what the Lancet is. It's one of Britain's top medical journals. And they came up with about 12, now 14 different things that you can do, or the individual can do to prevent dementia. And there's a whole list down there, over there, behind me. But you know what? Is that, come on. If you look through this list, you've probably heard all of these before, right? I mean, these are generalities, this is generic stuff, right? I mean, yeah, we all know we're not supposed to smoke, drink excess alcohol, and yada yada. Yeah, heard it, done that, been there, seen it all. Yeah, that doesn't help as far as I'm concerned. What we need are specifics. Specifics not just for in general, but for our race, our sex, our context, where we live, because those things matter. But let's talk about specific generalities. You know, there's a specific nutrient, a very specific nutrient that the Alzheimer's Association did a study on, and they found that it could reduce the risk of dementia by over, ready for this? 40%. 40%. Now, this list I showed you earlier, they came up with the same number. If you got all this right, 100%, you would reduce your risk of dementia by that same number. Now, think about that. One simple, single nutrient can reduce, you all know what that nutrient is? No? Well, I'm not going to tell you.
Well, I'm not gonna stay.
Gotta come back. Lock those doors. Stacy, lock that door. Nobody leaves.
Wait, I'm gonna take a guess.
Yes.
Protein?
No.
Red meat.
Red meat? No. Well, very close though. Red meat is really important.
I'm not giving it away.
Stacy, you dare not, better not. Just kidding. I will tell you, I promise, but at the right time. Promise. All right, so in order to really, and I feel this is important, in order to really understand what goes wrong, we've got to, and I feel this needs to be done right from primary school. Okay, what do you guys call it? Elementary school. I think brain health education should start from right then, if we're going to address this problem. So let's look at what the brain really needs. Or better yet, how the brain really works. But before that, I want to ask you guys a question. I want to do a quick survey here. The neuron, the nexus, and the network. How does that sound compared to the cell, the synapse, and the circuitry? Alliteration on both sides, but which one has a better ring to you guys? What? You think the first one does? The cell, the synapse, and the circuitry. I mean, they all mean the same thing. You like that? Okay. The neuron. So one for one. Stacy? The neuron, the nexus, and the network.
Yeah.
Well, they all start with N, right? So it kind of helps as well. Okay, thank you very much. I'll take that in advisement. All right, so this is really what we're talking about. Now, there are over, it used to be 100. Come right in. Oh, no, maybe not. The brain has 100, it used to be 100 billion, it's been downgraded now to 86 billion. I think I can understand that with all the things going around. We lose brain cells like crazy, right? The crazy world we live in. But no, it's actually 86 billion neurons. Now, between these neurons, every neuron has a connection with another neuron. And this is called the synapse. So one brain cell has to pass information to the next brain cell. Nothing happens in your brain or in your body without that happening. And there are about 100 trillion. I don't know who has the time to actually sit down and count those, but that's what they say, so I'm just going to take your word for it. Right? There are about 100 trillion synapses. One brain cell can communicate with as much as 40,000 other brain cells. So it's a huge mind-boggling complexity in the brain. But bottom line is that this has to happen. This has to happen before anything happens anywhere in your body. Okay? And that is the key to how the brain functions. Here's another picture here, and there's the network. And I want to use this analogy. We know now, according to Harvard studies and other things that are being done, I'm counting how many times somebody drops a cell phone. It happens every time. Eventually somebody's going to drop a cell phone again. I'm just kidding. But it's just like one of these common. Another thing that's really common I see is that there's always a smart aleck in the class that comes up with a joke. Almost every single time. I'm watching out for it too. Anyway, the network. So as we know, human relationships are super important. The Harvard study did an 80-year study in which they found out that those who were the healthiest and those who were the happiest and those who were the most successful are those who had the best quality relationships. All right? Very important. It's also important for the brain health as well. And we'll get to it again. one of the things that cause brain shrinkage is not having adequate or good quality relationships. Anyway, back to what an analogy is. As it is without, so it is within. The healthiest brains, the most effective brains are the brains that have the densest, the greatest quality connections. Not just that, but those that are able to quickly adapt, remove redundant connections, those that are not serving them, and they can reattach to other brain cells that are to form connections that work for the brain. Same thing as someone who is like a great networker. He gets rid of the network, he gets rid of his connections that don't work for him, and he attaches to those that work. As it is without, so it is within. So as a general rule, the greater the number and quality is important of connections, the better the life. Even memory, to form a memory, part of what forms a memory in the brain is the connections. So every time you remember, or every time you get information, a new connection is formed in the brain. As you're listening to me, your brain, believe it or not, is changing. You are not the same person. Your brain is not the same brain that it was when you walked in. It's a different brain. And it's changing every second. It's forming new networks, it's forming new connections. And it's doing that every tiny millisecond. Alright? So the greater the number of connections, the more powerful the brain, and here's probably the best example of it. We found out at his death, Albert Einstein's death, we found out that he had like 4 times more connections and thicker connections between brain cells and also parts of the brain. We have the left side and the right side. He had much deeper connections. And of course, he did a lot of thinking, imagining, and all those things. So that's why education is so important. That's why thinking, and that's why keeping your brain active. All of these things help in the formation of connections. But that's where the problem lies. Because these things, making these connections, are not cheap. They require a lot of energy. How much you think? How much energy do you think is devoted to maintaining this network? Any number, percentage? 5, 10%?
35.
35. Good shot. Anybody else? 35, 35, 35, 35.
60%.
60%. All right. Now we're making progress. Not that you were not making progress. That was a good start. That was a good start. I got it started. Boom. Yes. Yeah, right. It's about it's over 60%. And so remember this number. 2% of your body weight is your brain. It requires 20% energy and over 25% glucose. And this is all at rest. When you're really working hard, as you can imagine, the numbers increase. Even during your sleep, parts of your brain are working harder than if you're awake. So energy use is very important, and 60% at least is what is devoted towards maintaining this whole network that we're talking about. So are you beginning to see the problem? All right, let's paint it out a clearer picture. Normally, just living in this world to the age of 70. So at maybe 18, 19, you have the highest, 20, let's say 20. Your brain has the highest energy levels, right? Normally. And you can see the decline as it happens. You're getting lower and lower and lower to about 60%. That's normal. What we now see with people with dementia is that drop is a lot steeper. So it'll probably be like this. That drop is a lot steeper in energy supply. And therefore, it is not that the brain is not generating enough energy to maintain the network. So when you think about it that way, we can now, number 2, never fails. What happens when the energy levels are low? So, ever heard the term brain fart before?
Oh, yeah.
Very technical term, I promise. So this is what happens when you begin to lose energy in the brain. And this is even before you really have those really, what it was referred to as MCI, mild cognitive impairments. That's before Alzheimer's, full-blown dementia. We're beginning to see these things. I'm not going to spend time with this, but you can see a lot of this. I just want to point out a few things. Difficulty following a conversation. Some people think it's because they think it's a hearing problem. They go check their hearing out. I know it's a psychiatrist in particular. She was having all this, and she was having mood swings and sleepless nights and difficulty following conversations. So she went to check have her ears checked because she thought maybe she wasn't really hearing what they were saying. Found out her hearing was perfect. She got diagnosed with dementia. Luckily, psychiatrist, she knew what to do and she knew how to find the information, which was outside of the general information that is being given to patients. So she wanted to find results, and so she went outside the box, and she was able to reverse her dementia. Here's another one that keeps coming up, asking the same question over and over again. Sometimes it's not that they forgot your answer, it's that they forgot that they asked the question in the first place. And this again goes back to this whole network, the synapses. Everything you do and say and remember is related to that network. So if that network is not working, you're going to have those, like we said, brain farts. And the technical term is called a network instability. The brain's energy levels is simply not enough to maintain the network. So let's go back to the initial definition, and this is the widespread definition. It's caused by amyloid plaques. I can tell you this, that amyloid plaques appear in a lot of people who don't have dementia. It can be caused by a lot of problems, including infections. It can be caused by just sleep deprivation. You can have a lot of plaques in your brain by sleep deprivation. And I can give you a whole list of other things. And they've done studies in which they found there was a very famous nurse study. And I feel bad talking about this because I got to tell you, I consider the U.S. the light of the world. You know, the solutions are all here. And dementia is growing rapidly around the world. It's exploding even in Nigeria. People I never thought of are calling me now and saying their parents have dementia. If we don't get it right here, we're screwed. And forgive me for using that term, but that's really what's happening. If we don't get it right, we've got to get it right here. And people have to understand what dementia is all about. Because if we're just focused on one specific drug and one drug only, or one kind of intervention, which is the removal of these plaques, I'm going to tell you it's not going to work. And it's just going to cost us a lot of money. So, if your brain isn't having enough energy, it's not going to be able to do many of the things we just mentioned, including the removal of the plaques. Part of what energy supply does is helps you clean up afterwards. Part of what the brain does, and especially it happens during sleep. It helps you, during sleep is when the plaques that are built up during the day are removed. Okay? Do I need to stop? Okay. All right. So this is the new understanding. Is a disease caused by complex brain changes following cell damage. And I like this better because we now know that what is happening is that once the energy supplies are not enough, the brain goes into hibernation and it begins to pull back. And that's when you see the shrinkage in the brain. So part of the problem, the initial problem could have been a toxin or something else, but part of the problem also is that the brain is beginning to pull back, it's beginning to hibernate. Because that's a term that we're all used to, but that's because energy is not there. So the $1 million question, obviously, what's the question that is on your minds now? What's the $1 million question that you should be asking?
How do you prevent it?
Stop it.
How do you prevent it? But more specifically,
Stop it, how do you reverse it?
how do you stop it? How do you reverse it? But more specifically, how do you increase your energy levels?
Yeah.
because that's really what it comes down to. All right, so I'm going to kind of like rush through this. One, and the answer to that is twofold. You can increase the energy levels, and this is what I do when I'm working with my clients. Or, and probably more importantly, you can prevent the things that are reducing your energy levels in the first place. You can address the things that are reducing energy levels in the first place. And that brings us to what I call dementia's dirty dozen. And this is a checklist that I created after working with hundreds of people and speaking and treating and speaking and treating. And I came across these patterns. And does anybody see any commonality here? Oh, brilliant. Guys, you're great. Great job. All right, so that's kind of like what it is. There's actually, so yeah, okay. There's actually a QR code if you want to get it afterwards. You can just get it. It tells you how you can download the ebook that I created that kind of explains each of these. And that's very important because it helps you prevent, so you can know where you fall. And everybody is exposed to this to one of these in some way or the other, whether it's hypertension, diabetes, or insulin resistance, or mental health challenge. And so I explain all that, and you can obviously take advantage of that. But I want to talk, because we're in a healthy senior living center, I want to talk about things that are more specific to seniors. What happens to your brain as you age? We've already talked about energy levels dropping. This is a diagram of what happens over time. So conception, birth, by the time 25 is when your brain fully develops. So after 25, it's all downhill from there, right? Midlife is when the problems really begin, because all the natural forces, your natural energy begins to wane. This is a big problem for women, and this is one of the reasons, not the only reason, one of the reasons why women have higher rates of dementia is because of menopause. Believe it or not, estrogen is important for the brain. It's probably the most important hormone. And for some people, the decline is really steep. Other women, it's not so much. But that's a big problem. Big problem. Because estrogen, your protection. Remember the 3 pillars of dementia? Number 2, weaker defenses. Estrogen is probably one of the greatest defenses for the brain. And once some people go through menopause and they lose that defense, estrogen, that is a problem. Now, for others, not so much. All right, so by 85%, 1 in 2 people will have dementia. Let's move on. I know my time is fast spent. I want to point out a couple of things. Loss of smell. We saw this a lot during COVID. The smell part of the brain is one of the parts of the brain where new brain cells are created and made. If that part is damaged, it will affect your ability to make new brain cells and it gives you a 10 times, believe it or not, 10 times higher risk of dementia if you lose your sense of smell. Hearing loss is another problem too. It's probably about 4 or 5 times, but smell is really bad. They're proving this. After COVID, those who had loss of smell had a much higher risk of developing dementia. Even things as, we got to talk about drugs as well, medications, maybe at another time. But medications, even over-the-counter medications that we are so familiar with, they can affect especially seniors much worse than the regular 40, 30-year-old person. But yeah, this is the big one. We never knew this. But yeah, you are not supposed to use acid reflux medications for more than 6 months. I had a patient who had been using it for 40 years. And he came down with dementia. All right, let's say a few things about women. Anyway, I've got to move on to that. The main thing I want to point out about women, and I have kids that we treat them. So one of the top things, again, this is all context specific. You've got to address the hormonal component when you're treating anybody with kind of memory problems, especially women. And so that's a particular part I focus on, and I focus on using nutrients that can help the individual make the right amount of hormones. Estrogen, progesterone, testosterone, all important for the brain. in the right balance. And that's because in Nigeria we just don't have people, many doctors who can do that. In this country, you do. So you want to avail yourself of a doctor who knows what he or she is doing to help you ensure that your hormones are in balance. Yes, ma'am?
The issue I see is they tell you that estrogen is also a big cause of cancer. So they're very weary of it.
So they've revised that now. And in fact, some are saying that the medical establishment has to apologize to women because of the damage that they have done. Because that is no longer true now. If you do it right and you have the right balance, it can prevent cancer and dementia and heart disease. In fact, they are now beginning to promote the use of estrogen replacement now. I know. I mean, it's crazy. Yes, ma'am.
But the medical people, the stuff they give you side effects which make you worse than before. So they they have a whole lot to realize what they're doing.
Yeah. Okay. It's important, ladies, especially white ladies. You guys have a problem with osteoporosis more than black ladies do. Part of it is because of estrogen levels, part of it is genetics. One of the best things you can do for yourself is to strengthen your leg muscles. Because once there's a fracture, the numbers are terrible. 25% will die within that year. Most people will not leave the hospital after treatment because what happens. It tends to shake things up, and some people end up having dementia just from that fracture because of the shock to the system that happens as a result of a fracture. So among the top things you gotta do is you gotta exercise because muscle strength matters. We're now finding out. And obviously women have lower levels of muscles than men do, which is another reason. I have about 12 reasons. Don't you just love that? 12 reasons why women have a higher rate of dementia or higher risk of dementia than men do. Anyway, I have this picture here, Janelle and Jill. Jill is the daughter, Janelle is 80. And Janelle, after I did this specifically for women, a class specifically for women in Tulsa. And Janelle and Jill walk over to me and Janelle does this. She got flexes and does this. And she says, feel that. And I did. And then, I don't know what else we talked about afterwards, but all I know is that all I said was, from then on, it was yes man and no man. Because after feeling those guns, it was like, I do not know man, I do not want to mess with you. All right, so these are the three main categories that have the highest risk of dementia. They have twice the risk of dementia as men do, as the rest of the population do. Veterans, black people, and women. And I'm particularly concerned about this, and this is one of the reasons why I push as much as I do, because I personally belong to two of these groups. And I'm referring to the fact that I'm a man and I'm a veteran as well. Okay, so let's wrap up. So back to keeping your marbles. As we've said, what makes a person have dementia and causes his brain to shrink is because of greater attacks and fewer defenses over time. So the key is to reverse those things, reduce the attacks, increase the defenses, and take advantage of the healthcare professionals and know your numbers. I have this picture out here just as an analogy. So this is a castle and a moat. Let's think your brain is what is within the four walls, and everything else are the defenses and what is in place to keep the assailants out. So the key is to ensure that the defenses are in place and to minimize attacks. And I'm going to give you a few examples, just one example for each. So the attacks, I think there's no other, I think the best example is sugar. Sugar is in everything. Pretty much. You guys have you don't have a chance. You have the best minds in the world working on yourself, studied your taste buds from every possible angle. They know what it takes to get to you. Promise. The best minds in the world. And most of this sugar, salt, and other processed chemicals, just to keep you coming back. I'm here to tell you that your body only requires, no, it doesn't require, but what your body is comfortable with is about a teaspoon of sugar in the blood. All right, so if you eat a sandwich, which probably has 8 teaspoons, or a can of Coke, which is about 12 teaspoons, your body's going to do everything it can to drive it down within 2 hours to this. So what happens to those who keep on bombarding their bodies with sugar? And sugar is not just the sweet part, it's also starchy foods, and different kinds of things. So that's another aspect that needs to be worked on. You need to know what foods to avoid and what foods to focus on. That will help to maintain your blood sugar levels. Otherwise, we now know that high blood sugar levels destroy the parts of the brain that have to do with memory and higher level thinking, like judgment. It absolutely destroys it. So we're going to strengthen the defenses. So I promised I was going to come back to this. Has anybody thought about the answer to that? Somebody said protein, but not protein. Vitamin D.
D?
D.
Oh, D.
D. D3. D3 is probably one of them.
D3 you said, right?
Dog. D is in dog.
Yeah.
Yeah.
And a lot of women are low in vitamin D.
Yep, that's another reason, right there. Okay, so vitamin D3 is very important. And then the third one is to know your numbers. You've got to ask. It's not enough to say, if you go to your doctor and he says your D3 levels are okay, your sugar levels are okay. You need to know what those numbers are. You need to be sure those numbers are. Because I'm going to tell you this. So the tests, okay, so the top 3 tests, I recommend about 7 tests. And these are tests that can be done anywhere in the world. Again, I think from a place of of lack. But it has helped me a lot because I can translate it to anywhere in the world. There are some basic tests that can be done anywhere. Now, on top of that, you can do more sophisticated tests because you have access to them. You have access to the great hospitals. But there are some basic tests that apply across the board that will give you and give your doctor a reasonable assessment of where your brain is. Okay, but 3 of them are tests for blood sugar. People know about that, but insulin resistance is a separate test that must be done. Fasting insulin levels. You got to test your fasting insulin levels, and of course vitamin D3 levels. This is the range. Most doctors would say 30 is okay. I'm here to tell you that where your brain is concerned and where sleep is concerned, you should be pushing closer to the higher limit. Some doctors who treat sleep disorders, they say they don't get results until they hit 70. Okay? And sleep is a very, very important part of brain health. Okay, let's wrap this thing up. Somebody's excited. This is what we're looking at. We want to avoid a shrinkage of the brain. And this world is happening more and more and more. And by 2060, new dementia cases per year could double to 1 million. This is from one of the top journals. With Black Americans, this number is going to triple. So it's going to double for everybody, but it's going to triple for Black Americans. So that's a big problem. So let's wrap this up. Have I said that already? I did say wrap it up already, right? So.
What's your numbers?
Darn it. All right. The journey with 1,000 miles starts with 1 step. The one takeaway I want you to have from this, you've got to focus on energy levels, action steps. I'm just going to give you 4 to keep it simple. Make sure your vitamin D3 levels are optimal, and it's not 30 to 30, okay, above 30. Reduce your sugar intake, we talked about that. Prioritize sleep. You got to increase your physical activity, specifically strengthen your muscles. So resistance training is very important. Your muscles are a reservoir for everything your brain needs. Your brain needs proteins, it needs amino acids. It takes it from what you're doing with your muscles, all right? And so the key is going from this, low brain energy, to this. Does that kind of make sense?
Yes.
All right, thank you very much for your time. I really appreciate it. Thank you. So I'm going to open it up for questions. I just want to say you have my contact on the sheets. The QR code is here if you need it. And we are constantly, and we're always taking new clients. I have clients all over the world. Many of them I teach virtually. The key is I do like a 1-hour consultation, and we get to create like a plan, a treatment plan for them, where we work with them on a monthly basis. We got to get the right medications, or we tell them what they need to avoid, and just kind of like work with them to optimize their brains. So if you know you or anybody close to you that you think may benefit from it, by all means, I would appreciate the referral. And then let's see. So yeah, so I mentioned some of the things that we can help you do. I find that most people, once you point out where the issues are, they are more apt to make the changes that they may need to make. And some of these changes, as you've seen, are very simple, but they can go a long way towards improving their brain health. Okay, so there we go. All right, thank you again. Questions? Yes, ma'am. Well, you asked first, so I'm gonna ask you.
Two things really.
Yeah.
One, why are we seeing so much earlier dementia?
Yep.
Because that's been increasing. We see it earlier and earlier.
Yep.
And now I completely forgot the second just. No, and
First client, right there.
No, the second one, are there certain medications that cause it? Because, for example, I have a child whose ADHD was told to get off her medicine because her medicine can cause early onset. So I'm just curious if there's any correlation, or that was just something someone told her, because she has ADHD, she was on Vyvanse, told to go off it because she would have early. So I didn't know there's a correlation of why we're seeing it so much, because it is getting earlier and we're seeing younger and younger.
Yeah.
So that 80 age is not what we're seeing necessarily.
You are right about that. 50s and 60s. Pat Summit was in her 40s, right, when she started having dementia. So yeah, I mean, but yeah, it's getting worse and worse, and a lot of it has to do with the increase in toxicity in the environment. What we are exposed to is one example. The world is a much more toxin-laden world than it used to be. In our foods, in the air, in the water, in the drugs as well, and even in technology. You may not believe this, but these cell phones are a lot more powerful. Any device that can do what these cell phones do, that you keep so close to you 24/7, better believe it, it's causing problems. All right, so that's one reason. So drugs, yes, there's a whole, and I do a whole talk on with drugs, over-the-counter drugs, and there are antibiotics. There are things like Benadryl. All right, these allergy medications. They can have some really deleterious effects on, especially seniors, simply because metabolism is not as effective, so they're not able to clear and detoxify. That's one reason. There are other reasons as well, but yeah, over-the-counter medications. Over-the-counter medication can have a huge effect. Oh, yes, ma'am. You had a question?
Yeah.
Did I answer your questions?
Yeah.
Yeah.
I agree with your end about basically how it helps to do all those things that keep us healthy, exercising, eating while sleeping, not eating sugar.
Yeah.
I guess my question is, are you saying that by doing those things, I mean, it's proven in terms of improving your health by doing those things, that you're going to prevent, reverse? What is the claim that you're saying, that it's going to prevent you from getting dementia?
Yeah, some of them. Yeah, I mean, I'm not making a claim myself. I'm saying, yeah, I mean, I am saying it for a fact because of my experience. But there's objective experience out there. Like I told you about the 40% reduction by the Alzheimer's Association by using vitamin D. If your vitamin D level is optimal. So
yeah, I think that's a great one. My other thing was you sometimes use dementia and Alzheimer's interchangeably. So when you're talking about this reduction, are you talking about dementia across the board, because there is over 100 different kinds?
Correct, yeah.
Or are you talking specifically about maybe Alzheimer's and vascular dementia?
I think it would be general, dementia in general. Yeah, because right now we're finding out that even those that we call Alzheimer's disease are really a mix of different kinds of dementia. So yeah, in general dementia. I was going to tell you guys a story about a quick story. I forgot to say this before, but this gentleman who had dementia. His wife calls me from the UK, and he's really in bad shape. He has home care. One of the problems he had was, I mean, he was out of it. He would speak, so when he's trying to address his wife, he would speak to her in English, even though they have a different language. Yoruba is my language. And then when the nurse would come in, he would speak to her in Yoruba, although she's white and doesn't know a word of Yoruba. And then he would be watching TV, and then he would start reacting to the people who were talking. So it was as if it was part of the drama. I know it sounds really strange, but this is pretty commonplace in many aspects. That he was now shouting back at the people on the TV. He was getting upset with them because he thought they were addressing him. And so they called me, and then we stepped in. We bought a whole bunch of stuff from here. We shipped it to the UK. Cost some money, yeah, like half the price it cost you. Anyway, bottom line was that within not weeks, not months, but within days, he reversed and stopped doing all those different things. I mean, this is all to underscore the fact that what really is about, your brain has the capacity to fix itself. For the most part, it's been deprived of those things. And therefore, that's why I use the word hibernation. It just keeps going because the energy supply is not being provided to it. It keeps kind of shutting down and shutting down and shutting down. The way a business would if the revenues aren't making up for it. Kind of makes sense? So it's not about me being the superstar guy, and there are a lot of other doctors around the country who are beginning to do this as well. But the key is, your brain has a capacity to fix itself. It's just it's begging you, it's waiting for you, or the individual, to give it the tools that it needs to do the work that is required to fix itself. This is no mystery. And I hope I've made it clear as possible within my limitations as a communicator. But I hope I've made it clear, all right?
I do have a couple more questions.
Yeah.
You didn't mention medications that people are using currently, Namenda or Aricept.
Yeah. So there are, okay, we talked about the ones that are supposed to remove the plaques. They have complications as well, and you probably heard about them. Some are causing brain bleed, not brain bleed, okay. And some are causing swelling. Some are claiming that they're getting some good results, but this is only in the very, very early stages of the disease. And I can tell you most of my patients that they're late stages, and especially men do not like going for help unless they have absolutely no choice, and that's when they're forced to go seek help. So yeah, those drugs would not work for my clients. Now, Namenda and Aricept. So Aricept is probably the most well-known. Basically what it does is that it helps you increase the levels of one neurotransmitter called acetylcholine, which is the neurotransmitter, remember we talked about those, that helps with memory, okay? Now, the problem with that is that it only works for a couple of months. Same thing with Namenda. It only works for a couple of months and then it reverts. Because the problem of the brain is not one chemical. The brain is shrinking, it's dying. The structure, that's why I keep pointing to that picture. The actual physical structure is withering away. One chemical is not gonna fix it. You gotta rebuild, you gotta repair, you gotta regenerate the brain. And they're always selling medications are not gonna do that, I'm sorry.
I mean, and where I work, I mean, you hear anecdotal things, but I don't know that there's any real proof that any of them, because how do you know if it's slowing the progression of medication? You don't have a study, you can't study one person getting it and not getting it,
Yeah.
at least not in, out in the world. I mean, scientists could do that, of course.
Yeah.
To know if it's really doing anything or not doing anything.
Yeah. Although so I just go by what the loved one is telling him. If the person wasn't doing certain things and now he's able to walk and talk and react and respond, that's good enough for me. We'll just keep on moving because obviously we can't do like I said, all the tests. Are you a doctor?
No, I'm a psychiatric nurse.
Okay. Where do you work?
Levendale?
Okay. You have a lot of dementia there?
Not in my program. Well, we have sometimes early dementia or minimal cognitive impairment in our program, but it's a psychiatric program.
Right.
So if they have to be able to get something out of it, psychologically speaking, and even, someone with early dementia or MCI can still participate and help improve their mood.
Yeah. It's very, very, very true. Interestingly enough, a lot of psychiatric and psychological problems can be improved on, maybe not treated completely.
Right.
Again, with the right nutrients, because it all goes back to the physical structure of the brain and how the brain is working.
Right. And for us, it's like people that have just been diagnosed. Well, that's a depressing thing to find out that, you have a progressive disease that you're, going to be losing your memory. Sorry about that. I mean,
Yeah.
so, we can see people like that are in the early stages that, are still cognizant enough to be able to get something out of treatment.
Mm-hmm. Yes, ma'am.
I'm just curious, since it's neurologic and it's the brain, and I know it's a different disease, but do
Yeah.
any of those things help with Parkinson's?
Yes, very good. I have Parkinson's patients as well. Interestingly enough, Parkinson's is more difficult to treat. Thank you. Parkinson's is more difficult to treat than dementia. And so, dementia is relatively easy. But Parkinson's, oof. Oof.
But I do notice, like, someone who's really, really healthy,
Yeah.
who gets it
Yeah.
early, if it's not as aggressive, can live with it quite a long time
Yeah.
before, as long as they continue to exercise and continue, that they're living with it longer,
Yeah.
and before it's so degenerative that they.
Yeah. Yeah. Well, like I said, if they don't need to do that and just suffer with this, because there are solutions to that too.
Okay. Good to know,
Thank you.
because that's right behind dementia in the state of Maryland and growing.
Yeah. True. Very true.
Okay. Thank
You've been listening very quietly. I'm kind of
It's
concerned.
very interesting.
What part?
I guess just comparing it to what I already know. My dad has Alzheimer's, and
Sorry, yeah.
yeah, so he's at that point now where he will ask the same question over and over and over. So I can relate to a lot of what you covered.
How old is he?
He is 82.
82. That's my dad's age too.
Yeah.
Mm-hmm. Well, rest assured, there's something you can do. Yeah. Okay. I guess if Debris doesn't come and save me from this place, I'm gonna just have to save myself. Thank you very much.
All right.
Appreciate it.
Thank you. Okay, so if anybody would like to follow up with him